Unions representing thousands of Ontario healthcare workers are calling on the Ford government to take action after a new survey painted a grim picture of the profession. Tina Yazdani is at Queen's Park. Tina, what can you tell us about this survey?
Yeah, Melissa, the survey conducted by CUPE suggests that nearly half of Ontario's hospital staff are considering leaving their line of work. A startling number there. CUPE says they are overworked, stretched to the limit, and they've just had enough. Now, this Nanos survey polled more than 750 hospital workers. I can share some exact numbers. 41% of hospital staff say they dread going into work. Another 43% are considering another line of work entirely. CUPE says the biggest issue is this ongoing staffing crisis. We've been hearing about it since the start of the pandemic. They say it is only going to get worse if the province doesn't come up with a good retention plan. The current vacancies are taking a serious toll as healthcare workers are working longer hours to fill in the gaps. It's also taking a toll on patient care. Take a listen.
They are, working extremely hard every single day. There's 19,000 vacancies across Ontario hospitals. Often they're working short. This is one of our asks of, the Ontario Hospital Association around patient ratios. So if we had something around so many patients that a nurse or a PSW would have in one day, it would bring down their stress immensely.
Now, almost 80% of healthcare workers also say they're not confident that the Ford government will improve the healthcare system in 2024. We did receive a statement from the spokesperson for the Minister of Health right before this hit. I can read it to you. They say Ontario's nurses are one of the highest paid nursing workforces across the country. They say last year alone, the government added 15,000 new nurses, and they plan on growing and supporting the healthcare system for years to come. Melissa.
Now, that response certainly doesn't square up with the results we're seeing from this survey. Not exactly a positive outcome there. So how to turn this around? What kind of things are being asked for to help improve the state of our hospitals?
Yeah, absolutely. Well, specifically investments, CUPE says at least $1 billion is needed to improve the healthcare system. They say wages are nowhere near where they should be to retain staff. This staffing crisis really is, they say, the key to resolving all of this. And as I mentioned, it is taking a toll on patient care as well. When these healthcare workers aren't able to give patients the care that they say they deserve, it's taking a toll on their mental health, and they are leaving. So from the government, they do want more investments. They also want better staff to patient ratio. They want a minimum standard set right across the province so that patients can, as I said, get the care that they deserve. Melissa.
Well, certainly a loud message they're sending to the Ford government. That's our Tina Yazdani at Queen's Park. Thanks for that, Tina.
Thanks, Mel.